And we're back, dear viewers. Now, of course, as you all know, our eyes face daily challenges, from dust and sunlight to air conditioning and, of course, digital screens. To discuss how we can protect our eye health, we're here pleased to welcome Dr. Sara Alzanki, cornea and anterior segment specialist and head of the cornea unit at Jabal Hospital. Now, thank you, doctor, for joining us here in Good Morning Kuwait.
Good morning, and thank you for having me here. As we all know, our eye health is really important, as our eyes are part of the senses that are most important to us, and it affects all of us, from our kids to our grandparents. So it's really important to take care of our eye health and make sure that we take preventative measures to make sure that everything is okay with our eyes. In our daily practice with cornea and cataract patients, I see patients every day having problems that they see the world in, no colors are dull, yellow, they can't really see properly, and then after a routine cataract procedure, they're utterly shocked from seeing how the world is full of color, 4K, and sharpness. So it's really important to take eye care health proactively. Just like we see dentists and we take care of our dental care, we don't wait for a toothache to happen in order to, check our teeth. So we have to routinely make sure that we check our eyes as well and go to an eye doctor.
It is honestly like we've always heard since we were kids, الوقاية خير من العلاج. That just means to better, check yourself, before you wait for this stuff to happen. Now, of course, when it comes to eye, the thing is a lot of people just wait too long to discover something. For some reason, a lot of people neglect this body part. Like I know one of my friends who was colorblind, but he only discovered that when we were, I think, early 20s or something like that, because people just rarely go and seek, to get tested and everything. So in your opinion, why is it, or when is it do people take care of or have more attention to their eye health and everything? When do they start to have these kind of thoughts?
Unfortunately, what happens with patients is that they notice their eyesight when it starts slipping. So this is why we're talking about more preventative measures. So especially if you're older, you should actually have an eye exam annually, or routine eye exams. If you have any medical conditions like diabetes, if you have family history, as you mentioned, your colleague has color blindness. So this runs in families quite often, especially in the Middle East and in Kuwait. They have color blindness. So it's really important in these cohort of patients, if you have a family history of certain eye disease, to make sure that you get checked up regularly.
It is. Now, of course, when talking about Kuwait, we deal with a lot of humidity, we deal a lot with intense heat, we deal with a lot of sunlight, extreme sunlight. Also, we have air conditioning, we have inside room temperatures. So there are a lot of factors. Now, can you tell us about, what kind of these kind of environmental factors do, or I would say, affect our eyesight, our eye health?
Of course, what you mentioned was like the perfect trifecta of an eye storm. Okay, so with our intense summer heat, what's happening is that with our daily lives, we have this intense air conditioning from our homes, and then going into to the car, also air conditioned, and then in the office also air conditioned. So what happens is that this cold blast of dry air actually causes the tear film, which covers the cornea, which is the clear part of the eye, or the front surface of the eye, makes it evaporate faster. So it causes more dry eye disease, it causes more symptoms and signs. So in these cases, I do prefer to tell patients, like for example in your car, make sure that the airflow vents are not directed towards your face, always indirectly. Always try to wear sunglasses, always use preservative-free eye drops, lubricating eye drops, and always use a humidifier at home or in the office. It actually helps with your tear film and with your dry eye disease.
Now, in talking about dry eye disease, for a lot of people, they have itches, they have dry eye, they have soreness in the eyes, they have all sorts of things. But for a lot of people, they just connect all of those into one, right? A lot of people think all of those one, just because I think there's a lack of awareness when it comes to the regular people. Now, how can we as people differentiate and know the difference between whether we have eye, dry eye, we have allergies, we have soreness, the different kind of symptoms we're having?
Thank you. This is an amazing question, and there's a lot of people that confuse all three. So we have to know that usually with allergies, what happens is that this patient usually has other allergies in the body. For example, nasal allergies, sinuses, eczema, or asthma. And it's usually seasonal, so they get bouts of allergies, so they get this grittiness or itchiness that is uncontrollable. and this tells you that they have allergies. And it's usually like sometimes there's a trigger. So some people get it from pollen, so usually spring season. Some people get it from cleaning the house, from the dust or dust storms as well. So in these cases, we know that it's allergies. Dry eye disease is usually constant, so there's always this burning sensation, especially when we're looking at screens all the time, especially in the summer as well. So it's always a constant burning sensation in these patients. Infection, on the other hand, usually is like when you wake up, you get your lids all closed up, all glued up, with a lot of discharge, yellow, white, or green. And this signals that there's an eye infection going on, especially in contact lens users. If you do have these symptoms, make sure that you go to an eye doctor and get your eyes checked.
Yeah, as long as you know the symptom, you can treat it well instead of just, using whatever, off-the-counter kind of medicine you think you have. Now, we did mention a little bit about the weather, and in Kuwait, we often have dust or dust storms. And a lot of times what people deal with this is that they rub their eyes. Is that like one of the biggest mistakes a lot of people do whenever dust particles get into their eyes?
This is like the absolute worst thing that you can do when there's dust in your eyes. So I know it's counterintuitive, but you should never, ever, ever rub your eyes. What happens is it becomes a vicious cycle. You feel the pain, you feel there's something inside your eye, you start rubbing it, more pain, more rubbing, and it continues like that. So in order to prevent it happening from the first place, make sure that you don't actually rub your eyes. The first thing that you should do is try to get lubricating eye drops or sterile water or saline to wash and rinse out all the dust particles that might be inside the eye. And what happens is that it flushes out all the particles that are inside that you can feel. Sometimes what happens is that if you continue rubbing, this little particle actually causes more friction and it actually causes scratches on your eye, which actually makes the condition worse. So always make sure that you flush out your eye, rinse it properly, and if you still continue having this pain sensation, always go to an eye doctor.
It is, and I'm glad you brought up how it's counterintuitive, right? Because the first immediate thought every person has whenever they're dealing with eye issue is to rub their eyes and get the issue out. But that is actually the thing that is harming the eye the most.
Exactly.
And I'm glad also you brought the idea of salines and having these eye medications, because my mom discovered that she had, I think, dry eyes because when she sleeps they found out that she has her eyes open.
Exactly.
So and then they found out that I have the same thing. So now if you go to our fridge, it's completely, from top to bottom filled with salines and eye drops. And I think, ever since using them, it's always great, take advice to tell people to start using them. Like even if your eyes are healthy, the coldness you feel whenever those drops fall in your eyes, it's amazing. This is just a side rant to go into that kind of detail. Now, when it comes to the modern time, I would say a lot of people are on their phones, on their tablets, on their keyboards, laptops, PCs. What are, I'd say, some of the negative effects that a lot of sitting down in front of these screens are having on our eye health?
So thank you for asking this question. What we're seeing right now is an epidemic of digital eye strain. So what happens is that the more that we look at our screens, regardless if it's an iPad, a phone, even the computer screens, it actually decreases our blink rate by half. So when that happens, the lids actually are the ones that cover or give us a new tear film to decrease the dry eye disease. So when you have a decrease in your blink rate, what happens is that there's no new tear film to cover your cornea, and that actually exacerbates your dry eye disease. So I know I always tell my patients there's this 20-20-20 rule. So for every 20 minutes that you are working on your screen, take a break for 20 seconds and look at something 20 feet away. And what you can do with that is that it actually helps decrease this digital strain on your eye, relaxes the eye, and reminds you to blink.
It is, honestly. And because I have migraines, and one of the doctors found out that my migraines were connected to extreme light, which is ironic because if you've been in the city, you know how a lot of lights we have. Now, one of the things that he gave me, and it really helped with looking at screens, and the effect is immediate, these glasses with a very specific kind of coloring or tint. Whenever I'm wearing them in front of glasses, you can feel like the muscles here kind of ease up. So I'm not sure how medical that is, but it just helped tremendously. Now, when it comes to a lot of people who have, great sight, mashallah, they say we can see the furthest things away, we can see the closest things away. they think that they have nothing to worry about. Do those people also have to go and check up everything about their eyesight, about their eye health and everything?
Yes, so it's kind of like everybody thinks that if you have 20/20 vision, then they've got perfect vision. They don't need an eye checkup, but that's completely false. So what happens? We've got some silent diseases that can creep up. For example, we have glaucoma that affects the peripheral vision before your central vision. So you won't actually notice that you have problems in your vision until it's quite too late, unless you've got family history, of course. Patients that have diabetes, they can have their retina affected. Patients that have macular degeneration and keratoconus. These are all what we call silent thieves of eye disease. So it's really important for patients, at least annually or routinely, to have an eye checkup with an eye doctor to make sure that they don't have these things and we can catch them early.
Yeah, and I think one of the great practices that a lot of people can have is that to have that annual checkup, everything. In our household we call it the kharba day, right? You go get your blood work, get your eye check, get your vitamins check, get everything. Just finish with them, and just continue that on, year after year.
Yeah.
Just one day. Now, when it comes to a lot of the sunglasses, a lot of the aesthetics that people go for, they often choose style over comfort. Now, in your position, like, what are things we have to take, care of or attention of when we're trying to purchase new sunglasses?
So look, I'm all for style, but that does not mean that we go style over function. So it's really important when you're choosing sunglasses, make sure that it protects against ultraviolet rays. So UVA rays and UVB, these are quite harmful to the eye. So make sure there's usually a sticker like a UV 400 or it says UV protection. So these are the sunglasses that you need. It does not matter, actually. People think that the darker the sunglasses, the better. No, that's not necessary. So even if it's darkly tinted, if it does not protect against UV, then it doesn't really help and it actually harms the eye.
And so, just memorize this word, UV. Whenever you're buying a new sunglasses, tell them, do they come with UV or not? Now, when it comes to social media, I know from talking to a lot of doctors here in Good Morning Kuwait, unfortunately, there's a very large amount of misinformation, and a lot of myths, a lot of misconceptions on social media. And it's like a constant battle you doctors have to take, right? It's like an army of 2 or 3 against an army of 1,000,000. So what are these kind of misconceptions you're facing and myths that you are facing trying to correct?
Thank you. So like we see a lot of social media influencers claiming misinformation or myths. For example, there was one media influencer saying that you should not wear sunglasses because you do need UV rays to protect your eyes, which is, as we just mentioned, that is completely false. Another myth that I've heard of is people putting honey on their eye. And yeah, so please do not attempt to put any food in your eye, because that can contaminate the eye and cause infections. So it's really important to make sure that you go to an eye doctor and ask them these questions instead of your local social media influencer.
It is, and I think I'm going to take a stance here and say honey only belongs with a cup of tea.
Exactly.
Nowhere else. Now, Dr. Sara, I do want to thank you for joining us here on Good Morning Kuwait. Unfortunately, we did run out of time, so thank you again, honestly, for taking the time out of your day to join us and spread a lot of awareness about the eye health.
Thank you so much for having me here. It's been a pleasure.
Thank you. It's been an honor talking to you. Now, of course, the viewers, a special thank you goes to Dr. Sara, thank you for joining us, of course, and sharing these important topics. We are going to take a very quick break, but stay tuned.